Hello everyone, how are you all? Today let's continue Anesthesia 2022 paper. Let's start. Which of the following is required for the cannulation of newborn? For a cannulation, we need a cannula. What is the needle size? The greater the number of gauge, the needle size is very small. That is 24, 26, 28 are needle size are very small, which is used for pediatric age group. 22 will not use for newborn. So 24 we will use 5 ml syringe, yes, is required for flushing and all. Adhesive tape, yes, to stick it, and normal saline, yes, with to flush. So 2, 3, 4 and 5. 2, 3, 4 and 5. So option is B. Cannula gauge, orange is 14. Next coming to the gray color 16, white is 17 which is newly added, then green is 18, this is the parachute pink 20, blue is for 22, yellow for 24, violet for 26. They have given 24, that is yellow color, which is used for more than 1 kg. If it is less than 1 kg, again we have to use very small size, which is big gauge. As gauge increases, the needle size decreases. Hence, if it is less than 1 kg, again we are using very small needle, that is 28 or 26 gauge needle. Okay, that is violet in color. Coming to the second one, arrange the following anesthetic agent on the basis of their potency. This is the most potent and this side is the least potent. What is potency? Potency is nothing but inverse of MAC value. What is MAC value? It is a minimum alveolar complex, that is the minimum amount of drug that is required to produce immobility to painful stimulus. Hence, potency is inversely proportional to MAC value. Here the mnemonic is M his DNA is there, right? So M his DNO you have to remember. M for M, most potent methoxyfluorine, then his H for halothane, I for isofluorine, S for sevofluorine, DNO. What is D? It is desfluorine and nitrous oxide. Nitrous oxide has a highest MAC value, that is it is required in a more concentration, more amount of drug is required to produce immobility, hence it is least potent. Here they have asked on the basis of their potency, which one? First M, so methoxyfluorine is more potent, yes, so D is ruled out. Then M his DNA, isn't it? So H for halothane is correct. His HI isofluorine. S is not given. It's okay. Then D is given. No, D is also not given. Desfluorine is also not given. DNO, that is nitrous oxide. Hence option is A. This is second one is also done. Third one, identify the incorrect statement in rapid sequencing intubation. Okay, this is the one type of confusing question. Okay, but let me explain. Pre-oxygenation with 100% oxygen for 3 minutes is done. Okay, we can do that. High volume, low pressure cuff is used. Okay, it is a method of choice in cardiac arrest patient. See, now the patient, you can't feel the pulse. Do you start CPR or you intubate the patient? Think. We will not intubate the patient, right? First, we will take the cardiac care first. Then we will see the intubation or anything. Now, first is to give a CPR to the patient. So, this is not a method of choice. Only after making the patient is okay, stable, his cardiac activities are coming back to the normal, then we can immediately intubate the patient. Okay, post cardiac care. But in the Before that, we can't do intubation. Before CPR, we can't do intubation. Let's see what is rapid sequence intubation now. What is it? It is we are doing rapidly intubation. So we have to skip some procedure from the normal procedure of the intubation. When there is a more chances of a gastric regurgitation, pulmonary aspiration of the gastric content, like in common cases like pregnancy, full stomach, intestinal obstructions, poorly controlled gastroesophageal reflexes, and morbid obesities and diabetic gastropheresis. Here, in these cases, there is regurgitation chances are more. So, if we do ventilation here, the regurgitation will take place. But we can do pre-oxygenation. That is, we can give the oxygen for 1 to 3 minutes. So that is when the patient is awake. We will give 100% O2. After that, we will administer IV induction agent, that is thiopentone or propofol. At this stage, the patient will go to sleep. Okay, at this stage, patient will be unresponsive. We have to give here the cricoid pressure so that the gastric content will not regurgitate. Okay, that is called as Selleck's maneuver. After that, we'll give a IV succinyl choline in 45 seconds. Direct laryngoscopy and intubation is done. In normal patients, okay, we will ventilate the patient after giving all these induction agents. Okay, but here we are not giving any ventilation. That is, we are not giving any mask breathing. Only on the starting we will give. After that, we will not give. Then we will do directly laryngoscopy and intubation, confirm endotracheal tube placement, and remove the cricoid pressure. That is, we have to remove this maneuver. What is that? Selleck's maneuver. Okay. See, the rapid sequence intubation is not a choice in cardiac arrest. Okay. Coming to fourth one, which of the following local anesthesia causes hypertension? That is our coca. If you drink coca, you will get hypertension. Okay, this is cocaine. Cocaine, why? Cocaine inhibits norepinephrine uptake at the adrenergic terminals. There will be increased sympathetic stimulation, hence there is hypertension and ventricular ectopy. So the treatment for this hypertension, you can give benzodiazepine or alpha adrenergic antagonist and amiodarone. Okay, so that you can decrease the sympathetic stimulation. 2022 has only 4 questions. So we are done with this. Thank you. Happy studying.